how does this recurrence occur? Means how does this tumor recur? Local form of recurrence, that is local recurrence, where the primary tumor had started, there the cancer recurs, where the primary site and around the primary site there are draining lymph nodes. In those lymph nodes, once there is cancer somewhere and it can spread to the liver, lung, bone, brain. So this can happen in the secondary setting after completely getting cured. Is there any chance that cancer can recur? Yes, cancer can recur, but it can recur in those patients where there is bad tumor biology, the age of the patient is less, it all depends on the stage of diagnosis. Whenever a cancer is diagnosed, if it is diagnosed in a advanced stage or in stage 4, then chances of, although it gets treated completely, vanishes completely with the current form of treatment, there are always chances that it will come back. And third most common reason why it comes back is the tumor biology. So in tumor biology also, the different cancer types behave differently. So those cancers which are high grade cancers, that means which are fast growing cancers, have the chance of recurring faster. But having said that, even these tumors or these cancers respond very well to treatment as well. So they disappear as soon as we start some form of treatment like chemotherapy or targeted therapy, and then they come back or recur faster as well. Hence, try and find out the main biological factor why this tumor has come, and we go to the detailed testing for these cancers and find out the true cause of these cancers, and we try and target that particular reason why this cancer is happening, so that this cancer can be prevented from coming back again and again. Apart from that, the most important thing is completion of treatment. So whenever you have cancer, and we suggest, depending on the type of cancer, depending on the stage of the disease, we define a certain form of treatment. So that treatment may be unique for that particular patient. Not all cancers we are going to be treated in the same way. Hence, having said that, even the particular, say for example a breast cancer, it can be of 6 different types of breast cancers. So in each type there is a different form of treatment, there is a different sequence to the treatment. For few patients, we may just do surgery and get away with hormonal therapy as simple as in the form of tablets for 5 to 10 years. So this is the simplest form of treatment that a breast cancer patient can have, and they get cured within a few weeks of time, and they need to just keep coming for follow-up, so that we know that even if there is recurrence, we catch them at an early stage and we can arrest that particular site of cancer, increase the prognosis as well as the survival of the patient. Completion of treatment is one of the most important things in cancer treatment. Few patients face side effects and they do not complete, especially this happens in radiation. So they start with the radiation therapy, and in the middle peak of the radiation therapy, that is in the end of 2nd week or 3rd week, there will be a lot of side effects. So the patients tend to stop the treatment there or give a longer gap, and then the chances of recurrence, chances of the cancer coming back in these particular cases increases. Likewise, if we tell patients to take certain lines of certain cycles of chemotherapy, that is 4 cycles, 6 cycles or 8 cycles, then those all cycles have to be completed, because chances of again recurrence or chances of decreased survival happens if the treatment is not completed in time. And even the gap of treatment, each treatment is important. If the patient completed chemotherapy and gives a gap for 2 to 3 weeks and then we do surgery, this gap also shouldn't be more, so that we prevent recurrence coming back. And after radiation therapy also, we give certain gap of especially for rectal cancers, we give a gap of 6 to 8 weeks, and we do not go beyond 9 weeks, because the tumor biology is such that maximum response occurs in that period of time. Hence, we do not delay further treatment, that is mainly surgery after rectal cancer treatment, so that the patient is completely cured. And many a times main form of treatment would be either only radiation or surgery, because those are the local treatments which will act completely on the targeted organ, and either we completely remove that target organ by doing surgery, or give radical radiation and completely cure that patient with radiation. Hence, it is very important to keep a close watch and be on for regular follow up. Especially for in the first 2 years, we give a 3 to 4 months of monthly follow up, and in next 2 to 5 years, 6 monthly follow up, and after that, yearly follow up. So, how does this recurrence occur? Means, how does this tumor recur? So, there are three forms of recurrence. One is the local form of treatment, local form of recurrence, that is local recurrence, where the primary tumor had started, there the cancer recurs. And then second one is the regional recurrence, where the cancer, where the primary site and around the primary site there are draining lymph nodes. In those lymph nodes, the cancer can recur. Third is the distant metastasis. That means once there is cancer somewhere and it can spread to the liver, lung, bone, brain. So this can happen in the secondary setting after completely getting cured for the primary treatment. There can be recurrence in the distant sites like bone, brain, lung or liver, most common sites, or peritoneal cavity. So hence, to catch this cancers, catch the recurrence early and treat them better, we need to keep the patient on close follow up, and patient also should be aware that they have to come at regular intervals to the cancer surgeon or a cancer doctor. Thank you.